Hi.
Hi, Dr. Wilbur, Dr. Cook, and Dr. Menga. Very good to see you. I
Nice to see
changed,
you, sir.
Dr. Menga, just for you, I changed. I put a blazer
Okay,
on as
great.
well.
All right, now you look like a surgeon.
Right. I mean, most days. We'll give it another minute, and then we'll get started here. I'll introduce you guys, and then we'll get guys and gals, and we'll get started with the questions and conversation.
All right.
Do y'all have a good day?
Absolutely.
We did.
Yeah, it
Good.
was a good day.
What's the weather?
Miami?
What was that?
How's Miami?
Humid, warm, yeah, busy. Yeah, I was operating earlier, and then here we are now. Lots of delays between cases. Good times.
Yeah,
all in the day's work.
yeah, routine, right?
Yeah, your routine. Exactly right. Exactly right. All right, so let's go ahead and we'll get kicked off now. So welcome everyone to another episode of Behind the Scenes Conversations with Program Directors. My name is Tabs Iyer. I am one of the co-founders of OrthoMentor, and I'm really honored to have with us today the program director team from University of Rochester up in Rochester, New York, and that's program director Dr. Christopher Cook, and Associate Program Directors Dr. Danielle Wilbur and Dr. Emmanuel Menga. Dr. Cook is a pediatric orthopedist. Dr. Wilbur is a hand surgeon extraordinaire, and Dr. Menga is a spine surgeon. And it's really humbling for me and very, very big privilege to have the three of you on, taking the time out of your day with such a beautiful scene behind you. I'm kind of jealous right now because I've got curtains behind me instead. But thank you for taking the time. Really appreciate it.
Thanks for having us.
Yeah, thanks
No,
for having
no,
us.
no problem at all. So what we'll get started with some questions here, and obviously, as we talked about before, we'll kind of weave in the questions that get asked by students or faculty or residents that may be listening to our discussion tonight. But really, and this will go on for maybe about between 45 minutes to an hour. But we'll start off with the sort of kind of a basic question I like to ask, which is, how long have you been programmed? How long have y'all been on the program director team so far? And what are some of the key lessons that the three of you have each, and you can take turns answering this, each of you has learned during your time, whether it be shorter or longer periods of time, during your program director stint specifically?
I can start off. I'm kind of a new program director and an old program director. So I was program director earlier on in my career when I practiced in Canada. I was program director at Dalhousie University for 10 or 11 years. And then I've been program director here for a year and a half, maybe roughly, and replacing Dr. Gorsica. And I think over that time, I think what I've learned is that the best tenet that you need to have when you're a program director is to be honest. You got to be honest and transparent with the residents about what's going on and what you're thinking and where things are going. And I think that that makes everybody work better as a team.
That's a great piece of advice, and I think that. I hope I can share that in a program director role someday. So that's absolutely wonderful to hear. Dr. Wilbur, Dr. Menga, are there any things that y'all have picked up in your time as associate PD so far?
I think we were talking about that there's a lot more behind the scenes than you realize when you're a resident, how much work goes into it. And that's why it's good to have a shared responsibility between the three of us here. We have a big program, so there's a lot of residents to keep track of. And also it's good to have, different specialties represented, different backgrounds represented, because then we can, bond with individual residents and be easier access for the residents.
That's awesome.
Yeah, so I would agree with that. And I think the biggest thing you learn once you get started, I think we've been associate program directors now for a month. A month and a half. Yeah, almost 2 months.
So really super fresh. So that's great.
Yeah. So the first thing you learn is a lot of work, but it's fun. So you get the opportunity to get to work even. We enjoy working with the residents. That's part of the reason. I'm sure yourself. and us go into academics and work with residents. But you learn there's a lot of work, but you get to work even closer with the residents, and you have the opportunity to even help mold the residents and even mentor, closer mentorship as well.
Do you find with there being three of you, do you think that it's and especially with two of you being sort of new to the program director role or program director-ish role, and then Dr. Cook, you being a little bit newer to the Rochester program directorship specifically, do you think that there's a lot of things that y'all are picking up together, that having three of you is really tantamount to sort of making changes and improvising? Or do you think that it's, sometimes does it feel like there's too many cooks in the kitchen, if you will? And I am asking that purely out of curiosity, because I always see, hey, there's one associate program director and one program director from time to time. So just wanted to get your thoughts on how that sort of team integration works from y'all's perspective specifically. So I think we may have lost them for a second.
Yeah, we lost you there.
Maybe they're coming back. Okay, yeah, not quite sure what happened. Yeah, this app is great in lots of ways, but also has these, these issues. So it's to be expected. I'm not sure if my last question came through, but I was just asking, does it help y'all in the sense of being the three of you versus just one or two of you in terms of your ability to sort of divide and conquer, get work done, and in terms of being able to learn on the fly a little bit more adeptly, considering y'all are a little bit newer to the program directorship role, as specifically at Rochester?
Well, I think it's a definite advantage to have
We're getting stuck here a second, folks. I think, unfortunately, the reception is not being too kind to us. So we'll give it a minute, see if they're able to come back.
All right, we're back.
All right. It's all good. No worries whatsoever. So, Dr. Cook, you were saying?
I was saying that previous to becoming program director for 5 or 6 years, that I was chair of the clinical competency committee. So I was already very involved in this particular program and how it was being run. And so that transition was good. I think adding these two young people help a lot. There's a lot of new ideas and new modern insights, and we can get a lot more done. We each kind of divide and conquer and create new initiatives.
And that's absolutely. Oh, go ahead.
We have faculty mentors every year. So one faculty member who mentors each class for every year. And I was a faculty mentor for the past couple of years. So it was just, the next step in the progression. So
that's awesome. And Dr. Menga, how'd you end up there?
Well, by chance. They couldn't find anyone else to do it. No, so I think as Dr. Cook mentioned, we're all sort of already involved in resident education, and we're all involved in different communities within the department, the clinical competency committee. So we're already involved in evaluating residents, and I think when the time came when they wanted new associate program directors, obviously it's a discussion that was had with the program director and the chairman. And I saw it as an opportunity to work even closer with the residents and help develop the program.
That's awesome, and that's great. And that's great to hear. And I want to sort of pivot now to I think one of the questions that's always the calling out the white elephant in the room, which is for this cycle. And I'm sure the students that y'all are guiding, interacting with, what things are you going to be looking for specifically in this cycle in the prospective residency applicants that are applying to Rochester specifically?
I think I don't think that what's going on in the world right now changes the type of person who is going to be a good orthopedic surgeon for his or her patients. And so a lot of the things that we would look for continue to be the same things that we've looked for in the past. And, these guys said if you ask me this question, I should use this acronym that I use. And I have this acronym called HIRE, H-I-R-E. And H is humility and hard work. I is initiative. R is responsibility. And E is enthusiasm. And that's what makes a good resident and a good applicant. Right. And if you have HIRE, you'll get hired.
Right.
You'll be here all day.
Yeah, I like that. I like that. I think the students should jot that one down. That's really good to hear, and I think that there's obviously a lot of concern not being able to do away rotations in many institutions and most institutions, and I think that makes it a little bit challenging from the student perspective. So are there things in the application itself, knowing that the away rotations have been obviated, are there things that y'all are going to be looking for that might help you tease out those characteristics of HIRE or the characteristics that you think fits best within the Rochester culture specifically?
Yeah, well, I think every program is struggling with these times and these sorts of things, as are the students. But I think, in order to tease out those issues, we need to look at what people are saying about that particular person. And not, references and dean's letters and their personal statement. And I think the personal statement might be a little bit more important and a little tougher to write this year than maybe even some years gone by. And and then we have to work towards how we're going to do that for the year after when we don't have any step one marks to do. And I think that's an unknown for most of us at the moment.
Now that's a very, very good point. At Rochester, are y'all offering any sort of virtual experience for students to sort of participate in, and or have you been encouraging in kind of engagement, and and what kind of ways have you been encouraging engagement with students at large?
So we've done a lot of work in this regard. We have I would call it not a committee, but more of a task force that's been very active in this. Maybe both you guys could kind of make some comments on some of the initiatives we've had.
So there's several things we're working on right now to help. I think I discussed some of this with you. Several things we're working to help at least showcase our program to all the students who are currently applying. So I think the first thing I'll recommend, I think going back to your question with regards to virtual sub-I, yes, we do offer a virtual sub-I. I think if you log into our department website or to the residency program site, you find the directions on how to apply. Or you can contact our program coordinator directly, and she will guide you on how to apply for the virtual sub-I. There's several things we're also working on. Obviously, as some may have noticed, we're switching more now to a virtual wall because of COVID. So we're expanding our website to actually be more representative of what our current program is. We're sending out newsletters to, We're sending out newsletters to, we're hoping to send newsletters to all the potential applicants right now. So I think I'll strongly encourage all those watching right now, and if you have friends who are interested, you can either follow us on Instagram or send a message on Instagram, or send a message to our program coordinator on how we can get the newsletter to you to showcase our program. So we remain we're still very motivated, and hope that we can still accomplish what we could have accomplished beyond COVID.
That's awesome.
And then also on the website, we'll have a lot of videos where, like, a couple of the residents will give tours of the hospital, and some we have a really robust media department at the University of Rochester who are investing a lot of time and commitment from the media team to really develop these videos to showcase all the residency programs. And we've been taking, as Dr. Cook said, a huge task force to have residents and attendings involved in this, and former graduates as well, to really highlight what is unique about our program.
That's awesome. And you know, and I think so let me ask you a question. I think that's just important because, you know, we were having an OrthoMentor board meeting last night, and before, myself and one of the folks were talking about, you know, what people are doing at different institutions. So what is the driving, so it is impressive to me that y'all are doing this because not every program is doing it, and not every program is doing it with, you know, whatever gusto, like from what it sounds like you guys are doing. So what's the motivating factor here for Rochester and you at the helm of it? What's the biggest motivating factor to sort of push forward to develop all these initiatives, you know, kind of overall? What's sort of, you know, inspiring y'all to move, you know, kind of pick up the pace on this?
Well, I think it goes back to what I said about needing to be honest and transparent. We need to push forward, and you know, we would normally have an opportunity to do similar things with people that come here for interviews, or have the opportunity to come here if they wished for sub-I, and we could showcase our institution to them. It's a mutual decision here, and so we feel a responsibility to those individuals to let them know that we're interested in having people come here if they're interested.
And also the elephant in the room, so to speak, too. You know, it's Rochester, New York, so we don't have, you know, Miami, right, to recruit people to. So we need to showcase that it's not this stereotypical snowy, cold city. It is like that, you know, half the year, but
yeah.
And it's
85 and sunny today.
That's why we have seen the sun in Rochester.
So we have to, you know, highlight that, you know, we do have attributes and it's a nice place to live, and we don't get to prove it to you when you come to see it. So we'll have to try to show it to you online.
It's actually really funny you say that. So when I interviewed at Rochester for residency, I was there in the thick of, you know, it was super cold, and one of the attendings had shared with me that he had, I think he was plastics in hand, so he was like a combination, and at that point in time, and he was describing to me how he had an ice skating rink in the, like, behind his house, and I said, I'm going to move Rochester to higher up on my list just so I can go ice skating behind this attending's house. Obviously, it didn't work out, but, you know, that's another thing I just want to chime in with about Rochester and how great it is. One other thing I do want to say, that Rochester has also been, and at least for me, Rochester has been, you know, from a research perspective, has always been super top, you know, top like 10, top, you know, maybe if not top one, number one for NIH funding for orthopedics, and has been for years and years. I don't know if that's still the case or not, but that was something that really drew me personally to Rochester when I, you know, when I went out to interview there.
Yeah, and it still remains in the top. It still remains in the top
two or three.
Top two or top three, and also obviously there's a strong motivation now to do PROMIS, you know, clinical PROMIS study, and Rochester's leaders when it comes to studies looking at PROMIS database.
Plus, the musculoskeletal research lab is one of the top funded in the nation, not just for, you know, the Department of Orthopedics, but for our PhD candidates and things like that too. So very strong lab presence as well.
And I think
that's awesome.
And it goes back again to, you know, the motivation while we're interested, while we're going out of our way to showcase our program, is because we stay very enthused about teaching young students and residents. And we're very motivated. That's why we do what we do. So I think we're very encouraged, and would like to get the best students and teach them and mold them to become orthopedic surgeons.
That's awesome. And so on that note, what would you consider, and the three of you can share your thoughts independently, what would you consider are the top three highlights of Rochester's program specifically?
Well, I think highlights and strengths may be kind of similar things. I think one of them is that everything is very centralized. So we have divisions in every subspecialty in orthopedics, and it's all located in two hospitals 3 minutes away from each other. And so, and it's all part of our institution. And so it becomes a very reasonably well coordinated education, not having to be farmed out to another institution for a certain rotation, etc. I think we have a very high volume of patients. I think 180,000 clinic visits. I think last year, something like that.
Oh.
Rings a bell, and
12,000 OR cases as well. So.
12,000 OR. So I mean, so there's a clinical volume there as well.
Yeah, I think another thing I would add to that is besides being everything is centralized, so you don't have to travel out for your rotations. I think another thing we feel strongly about that the residents would get out of the program is so we're a true level 1 trauma center. We get both the cold, hot trauma. We're close to the highway. So that's one of the benefits of being close to a ski resort and mountains to hike on. So we see every injury. By the time you're done with residency, you feel well-rounded regardless of what specialty you go into. I think prior to getting on the live chat, I think we're talking about our experiences as far as our experience during residency and also experience as faculty members. So as a spine surgeon, I was taking general orthopedic call for maybe a couple of years out of residence, out of fellowship, because I felt comfortable taking that trauma call. I think we've all done the same. And I think that's one of the strong points about Rochester, where you get the strong trauma experience and you can do anything coming out of residency.
Yeah, you don't have to do a fellowship. You'll graduate from here being able to operate and not have to necessarily do a fellowship. But that being said, they do match into some of the best fellowships in the country. And another draw, I think, too, is we've been talking about that you don't have to travel anywhere. So we also have multiple attendings in every division, so you don't just get one way of doing things. Specifically, as a hand surgeon, we have 7 hand surgeons in our division. So we trained in all different locations, so we bring a lot of different ideas to the table. And we get all types of injuries. We have farming community, we have a boating community with all of the lakes. We have the Great Lake, 20 minutes away, so we get bad boating accidents and things. And then we have a lot of industry around too, so we get the penetrating trauma, the car accidents, the farming injuries, and so you'll see everything.
Dr. Wilbur, you need to say hello to Dr. Ketonis for me. Who I've known Konstantinos for a very, very long time now. So yeah, tell him I said hello. One of the things, when he was doing his MD PhD in Philadelphia, I had taken a year of research, and so we did a lot of work together at that point in time. That's how we know each other.
My resident, when I was a hand surgery fellow at Philadelphia, he was my fourth resident on my rotation. So
go figure. Small world, right? Super small world. So let me ask you, y'all are, super enthused about the program, a lot of great highlights / strengths. What kinds of things are y'all looking to improve upon? What kinds of things are you looking to sort of, make better at Rochester, despite how great everything sounds from what you're telling me so far?
Well, since I've become program director, and these two individuals are also heavily involved in this, is that we've created a couple of initiatives. First of all, our curriculum setup hadn't been reviewed in quite a while, and we've created a large curriculum review committee who's looking at what the best way to teach orthopedics in our program would be, what type of technology should we use, and so on, how long should they be, what topics, how to deliver it, all this sort of thing. Then we've also created a rotation review committee that's looking at what the rotations are, how long they should be, when should they be, what progression should they be at, and to try and create a combination of those two things to really elevate the program over the next year or two. I have to say, in addition, we've got a fairly robust skills lab program that has skills lab settings every Thursday afternoon. Also have cadavers available to it. We also should mention that we're going to be building over the next couple of years. This group of residents coming in will be part of it. A brand new musculoskeletal building that would have outpatient surgery capabilities, a musculoskeletal skills lab that is 3 or 4 times bigger than what we have now, and all of the various different clinics in the same building. So that's kind of exciting for us too.
That's absolutely awesome. Any other thoughts there, Dr. Wilbur or Dr. Menga?
What I was going to say about the curriculum is that, a lot of research is coming out, especially in adult learners, not everybody learns the same way. So we're trying to make more engaging didactic sessions. So it's not just an attending up there lecturing with a PowerPoint, and trying to engage different ways of learning so that we can, educate every resident who may not just learn from a PowerPoint presentation and get more hands-on experience and things like that. So that way we can streamline our education to match what the lecture you're getting that morning is going to match what your didactics will be later on that day, and also match what will be in the cadaver lab that week.
So try to make it very cohesive, and B, you're getting it from different angles, different times, repetitive, to try to really instill it and ingrain it. Yeah, no, that's a great approach. There's a couple questions that have come up that I want to sort of bring through as well. One was with regards to IMGs, International Medical Grads specifically. Do you all evaluate IMGs through the normal ERAS process? Through the normal ERAS process, but that's something I wanted to kind of put out there at this point.
So they're evaluated through the ERAS process. We have had a couple of IMGs interview with us over the last couple of years. So it's not a just based on the principles we've already discussed. It's not a complete rule out.
Got it. Okay. And usually what are at least from an academic perspective for students to be aware, what tends to be some of the academic markers of those international medical grads, or attributes of those international medical grads that you either interview and or if they have matched in the past, that of the ones who match?
So a lot of the international medical grads would also have to have their step 1 done, and their dean's letters, what specific universities they might be coming from, and what the references are like, what people are saying about them.
Right. Okay, that's great. What about on the same note, osteopathic students? Are y'all, knowing that the match is now merged, especially within the last year, are y'all going to be looking at osteopathic applications this year? Is there a trend towards doing that over the next couple of years if you're not doing it already?
No, we haven't discriminated between the two.
Okay.
We have on faculty, Ron Gonzalez, one of my partners who's a hand surgeon, is a DO. Okay, so great. Have you?
Okay, perfect. Have you guys have y'all matched DOs or IMGs in recent years, even in the last 2 or 3 years?
We have not, but it doesn't mean that we didn't rank them high enough that they could have been.
Okay. Okay, and that's good to know. What are some of another question that came up just a second ago is, what are some of the sort of, what kind of characteristics in your mind, I know it goes back to that higher thing, I just want to circle back to it because someone asked right now, what kinds of characteristics really stand out amongst applicants who end up getting interview invites, and then B, end up matching, matching at Rochester specifically?
I'm sorry, what?
So what kinds of attributes of an applicant would often bode well for them to potentially match at Rochester specifically?
Well, I think clearly it gets back to the higher aspect, right? But in addition to that, when you look at the applicant and what their application would be, it's important to see what people say about them. Clearly, just about everybody who's applying is academically sound. And so you have to take that to a different level and try and glean the personal characteristics, that would include somebody who would have those higher characteristics, who would work in a team setting, have good common sense. That's the type of individual. It doesn't necessarily have to be an individual who wants to do 50 papers during their residency program, right?
No, and that's
the letters.
good.
I was going to say, as he said, the letters, we really look for, the hard workers, the people with common sense, the people we know that, because we all know that academically that they'll be on the level, and we can teach the knowledge, but you can't teach a work ethic and common sense.
Well, that's absolutely awesome, and I think that's one thing to really highlight for everyone who's asking those kinds of questions. And so I talk to probably an average of anywhere between 1 to 2 students a day, and who reach out and whatever, and I tell every single one of them, there's no formula, right? There's no formula. It is a combination of things, and everyone's asking, oh, do I have to have like 10 first author publications or whatever it might be, or XYZ things? I said you can be perfect on paper and still not match. And it has to be, just as, as this dream team is saying, has to be a combination of attributes that really speak to the culture of that particular program. And while you might fit well at one program, you may not fit well at another, and that's something just to keep in mind. Tell me what the clinical exposure is like at Rochester, and what's the operating experience like for the residents there?
Yeah, sure. So for the clinical experience, so obviously I think like most programs, the residents spend time in clinic from their intern year. Obviously the curriculum has changed from the ACGME requirements. We've gone from, back we used to do 6 months of orthopedics and 6 months of general surgery, a few months of orthopedics, and some elective. I think now it's more over 3 months of, or 3 to 4 months of orthopedics. Or 6 months of orthopedics and some general surgery. So that's still the same, I think, across the country. And most of our interns, as far as the experience during their time on orthopedic surgery, they spend time in the emergency room, taking call with the second-year resident, managing patients on the floor. So it's almost like, like an internship to working your way up to become a second year and be responsible for those patients individually. They spend time in the operating room. They spend time in clinic with the faculty members, and they also spend time in the skills lab. And this carries on throughout the second, third, fourth, and fifth year. So I think I would say, speaking from my service, and I'm sure they will say the same, when the residents come into the operating room from day one, we get them involved right away. I think that's one of the great things about, we're all very excited and interested in teaching residents, and you believe in residents observing before taking part, but you can teach them and watch and see what they do and get them better.
Along those lines, we do also have a research boot camp for the new people coming in, to get them into, how do we go about putting together a research project and so on. And then we also do an intern surgical skills month, where for a month they spend time in the surgical skills labs and do sawbones and cadaver dissections and put plates on and learn how to drill and that sort of thing.
That's absolutely awesome. I mean, it sounds like I need to take some lessons from y'all, because I've been trying to develop a skills lab here, and I've had to make shift with sawbones and like the medical school labs in order to, as I always say, MD stands for make do. So certainly we need to take some pointers from you all. Tell me a little bit about what the chemistry amongst the residents and the faculty is like, and then what the chemistry amongst the faculty themselves are like as well.
Well, I'll speak to between the faculty. I think generally It's a big program, and it's not like there's 10 attendings. There's 55 attendings, roughly.
Hmm.
But there's no kind of, it's not like there's a bunch over here and a bunch over here, and neither the two would meet. Everybody still feels like they're part of a department, and there's really not much what we would call town gown between attendings and specific competition like that. I think generally everybody gets along fairly well, and certainly lots of different attendings will engage socially outside of orthopedics, and so I think that happens a lot.
As far as the faculty-resident relationship, I think is very strong. I have a great time working with the residents, teaching them, but also learning from them. And I think that's very important. With part of learning, or part of growing and teaching is also learning. And you can always learn from someone who's not potentially at your level. So I do enjoy, and I think I remember even just earlier today during my case, and I told my fellow and the resident who was involved in the case, I told him to speak up if they see me doing something or something they think could be done differently, because that's how we all learn. I've had to change what I'm doing in the operating room a couple of times because the resident asked about it. I said, let me try this way and see if it works. So we have to be open to learning, and I think that creates a trust relationship between you and the residents. So you respect each other, you teach each other, and obviously they're here for us to guide them, and the goal is to make them better than who we are.
We also have a retreat that we go on every year. So our retreat's actually coming up in a couple weeks, where the rising 2s and 5s, along with about 10 to 12 attendings, go to sleepaway camp, so to speak. Usually it's 2 days, but this year due to COVID, it's only 1 day. The residents take a bus down together. Some of the attendings go on, some drive separate, but we go to the Biggest Loser Fat Camp. The Biggest Loser Fat Camp is in the greater Rochester, Buffalo, Niagara region, and so it's only
That's
about
funny.
an hour from here. And we go there, and we have team building exercises, lectures, and a bonfire at night where we have putter ball and flip cup and all that good stuff to build camaraderie. And then, as I was talking about earlier, where I was a previous class mentor, is we have one faculty member each year, and probably 2 from the years to come, because we have 8 residents a year, who are paired up with faculty. And that the job of that mentor is to take out the class and all their spouses and or significant others, boyfriends, girlfriends, and that, so that not only can we build camaraderie between the attendings and the residents, but also to introduce the residents' support systems to each other so that they can build their support system as well.
I think you hit the nail on the head there, and what I'm getting at, and I think I really want to highlight, is the fact that y'all have you guys are developing a mentorship program from the outset. And whether it's investing in the medical students, like it sounds like from some of the initiatives y'all have been discussing, all the way to the investment of time into developing this relationship in the OR outside of that, that's absolutely wonderful to hear. And as someone for whom I take a lot of pride in the advising and mentoring that I do and spend time doing, I'm so impressed with what y'all have. So huge kudos to you, and I think that's absolutely amazing that's what you have set up. What you have set up at Rochester specifically.
Thank you.
Thank you.
Yeah, no problem. So is research, one thing I want to ask, because I know obviously Rochester's a huge research powerhouse, and then I want to go back to some of the questions that have come up. Is research required, and what kinds of research projects do residents get involved with, and when do they get involved with research if they do so?
So there are research rotations. So there is some research requirement. There is an expectation that you would publish a paper as part of your residency program, but it's not a written rule, and there's no quantification that you have to reach of amount of research you've done in order to be promoted, etc. There is a very strong support system there with all the individuals and expertise and stats and helping to coordinators and things to help put things together. And you can do research. You can do research from a clinical paper on scoliosis to a basic science paper on growth plate metabolics, and biomechanics is all there available for you. We also have a research year that some people wish to avail themselves of. That adds a year to your orthopedic residency, but that research year has been popular for many.
We do have a good spattering of residents who are interested in, bench research. So we have people who can help you along with, the basic clinical science research. Then there's the purely promise data who every single patient who comes into our clinic gets an iPad and has to fill out a promise at every visit. So for across all the divisions. And then we have pretty much every faculty member has their little niche that they like to do. And so basically we try to get residents who are involved very early on. So identify what they're interested in, and even if you have no idea, try to get you involved in research early on in your intern, even second year.
That's great. And I think what I want to just highlight to students is the fact that research is not critical, but it is the cornerstone of a lot of what we do in orthopedics. And University of Rochester has such an amazing. I've seen the lab; it's absolutely amazing up there. And so certainly, it's a great place to check out. If for nothing else, and certainly the amazing scene behind y'all for definitely that lab, because they have a lot of great opportunities, available. So a question that came up earlier is, do you guys accept, or are you encouraging submission of that AOA cord standardized letter specifically?
My understanding is that we've done that before, and we'll continue to do that.
Okay. Yeah, so I know a lot of the students are sort of, worrying, I don't want to say freaking out, but worrying about whether they should get a narrative letter or this standardized letter, that the AOA and Cord Residency Director Council has been espousing for a few years now. And what I've been telling students is, hey, just get a combination of both. It doesn't take long to fill out that little evaluation, and then you can have a narrative letter that accompanies it. So, so good to hear that y'all are.
Most of our patients have a combo of that cord evaluation form and a narrative letter.
Got it. And I think that's what many places are doing. Another question that came up that I want to ask, and this is something that I have been thinking about since I saw it earlier, is have you encountered any applicants or prospective applicants who are otherwise competitive but have some sort of legal ding on their record that they have to report? And if you have encountered that, have you offered interviews to those applicants in the past? How do you view any sort of legal issue that may have taken place prior to medical school, but in an otherwise competitive applicant?
Honestly, in terms of legal issues, I don't remember in the last 3 or 4 years of our applicants that has occurred.
I've actually, I think I saw it on a letter last year on one of the candidates that I interviewed, and so clearly he went through the review process and still got invited for interviews. So, I think what the question is getting at is maybe students being prejudged based on a potential legal issue that came up that the student was possibly vindicated for. So no, I think I've seen that before, and the student made it for interview, and I was actually very impressed by the candidate. I discussed it with him. It came up obviously you can't just ignore it. So I brought it up and we discussed it, and I think I'd ranked him as one of the top students I interviewed for during that interview day.
Yeah, acknowledge it in your personal statement. Don't try to bury it. Just right up front, because you'd have to check that box. Have you, misdemeanor or something like that. I think I interviewed the same person who, and so I've ranked them highly as well. And also for our fellowships as well, I'm involved in the fellowship program for hand surgery, and we've interviewed applicants who had to check the box for misdemeanor, and says describe it in your personal statement, address it head on, and don't be shy because you'll still get interviews. If you try to bury it, that's when if it's discovered by us later on, that's worse than if you just bring it up front.
Yeah, I would say the same thing. Be just transparent, be honest, and I think you're more forthcoming is probably if you're more forthcoming, it's easier to discuss it and discuss how what you learned from it and how you drew strength from it more than anything else. I think that's often helpful. I do want to just circle back to something that was brought up earlier. International medical grads, and this is just a perspective I have, and y'all can please feel free to chime in with it. Many times have there's great international medical grads that are out there, but they are sometimes viewed a little bit more stringently at some programs. And so with that being said, many times you have to take time to do research. As Dr. Cook was saying, the letters of rec need to be, quite stellar. Scores often have to be reflective of that too. So even at many programs I've sort of, talked to, IMGs are certainly welcome to apply, but knowing that it's a little bit of an uphill battle. So that is something that you need to be aware of as well.
Agreed.
Mm-hmm.
Okay. Someone asked another question. I just wanted to make sure I brought this up here. I think someone is asking if this is related to orthodontist, and I said no. And I'm saying no. This is not about orthodontist. This is about orthopedic surgery, which is surgery for hips, for bones and joints. And the conversation here, just to clarify, is with three program directors from University of Rochester who have been amazing with their time tonight. We're almost at an hour right now. We're just a few minutes from that. Does anyone else have any other questions before we sort of finalize things? I want to thank the three of you here tonight, Dr. Wilbur, Dr. Cook, and Dr. Menga, for your time. Do you have any closing thoughts, any things you want to share to really highlight how amazing Rochester's program is before we finish out tonight?
I think you see amazing here, so so you can see it. No, I would strongly encourage all the applicants to look into our program, and it's not because we're desperate, but because we're very motivated to teach them.
We have a big program.
We have a big program, and we're very motivated to get good students and good residents. So we strongly encourage them to check out our website. You can submit questions to the residents through Instagram or through the website or through the program coordinator. And I think we have a lot to offer.
That's absolutely wonderful. There's just a couple of questions that came up. One is, and just to clarify, this is specifically for after medical school, at the tail end of medical school, when you're applying into residency, which many medical students are doing right now. And also, can the three of you just share what the road has sort of been as far as becoming a program director in terms of your educational training to get to this point?
Well, director for the first time, I had been a fellowship-trained pediatric orthopedic surgeon for 6 or 7 years, and had been involved in a number of different types of committees, and then finally got appointed to be program director at Dalhousie University. And then I came here, and then at Dartmouth. I was at Dartmouth College for a little while, and I was chair of the curriculum committee there, and then came here and was clinical competency committee chair for 6 years, and it took all that before I was able to become a program director here. So it's nice to have experience when to deal with a program of a larger size, and that's what. I think that's what having an associate program directors is all about, is to create future program directors.
So my road, I'm now just started my 6th year of practice as a hand surgeon, ortho trained, and then a fellowship in hand surgery. And I basically wanted to do academics to be able to be involved heavily in medical student and resident education. So I got to pick one of three paths, and I picked like clinician educator pathway. Not so much research based, but more curriculum based and things like that. So I'm very heavily involved in the medical student education and help to build their musculoskeletal curriculum, and especially during COVID, making a lot of videos and things like that for them. And as well as involved in high school education and med school education through the Perry Initiative, which is for introducing young women to the fields of engineering and orthopedics. And so then it kind of just parlayed into getting a phone call one day from Dr. Cook saying, hey, we're going to start associate program directors, and we would like the two of us to come on board. So I was very excited to step up to that role.
Yeah, so my pathway, I suppose. I've always been motivated to teach and to mentor, students. Prior to taking on the role, I also served as the associate program director for the Orthopaedic Spine Fellowship, which I'm now the program director for. And I've always enjoyed working with residents, teaching residents, medical students, undergraduate students. I have an army of undergraduate students I work with at the University of Rochester who come and spend time with me in the operating room and also in clinic. So it's always been a motivation. And so when Dr. Cook asked me to take on the role as the associate program director, it was easy yes. So I think we are all very interested and excited to get involved and work to get the residency program. The goal is always make it better.
That's absolutely wonderful to hear. And, you guys, the three of you are truly inspirational. I don't want to take any more of your time tonight. Someone asked if you'll get COVID if you go to the dentist. That's not a question that we can answer per se. You should talk to listen to the news and talk to your primary care doctor, but be safe more than anything else. Thank you to the three of you for your time tonight. Really appreciate it. This YouTube or Insta Live, is being recorded. We will upload it to the OrthoMentor YouTube channel in the next couple of days. Dr. Menga, Dr. Cook, and Dr. Wilbur, thank you again for your time tonight. It was a real pleasure, real honor. Thank you again.
Thank you so much. Thanks.
All right, have a good rest of the night.
All right, you too. Thanks.